Welcome to TimeBeat Breaking News Channel. Here are our breaking news today.
1. COVID vaccination testing are given to children aged 5 and up. 2. Vaccinate the world against COVID by the end of 2022.
COVID-19. COVID vaccination testing are given to children aged 5 and up. Russell Bright, 7 years old, grabbed his father's hand tightly as Pfizer's COVID-19 immunization trials for children ages 5 to 11 began in Louisiana on Monday. At Ochsner Medical Center, just outside of New Orleans, children held teddy animals, played beneath chairs, and a few cried. Their temperature and blood pressure were taken, their noses were swabbed, and blood was taken for testing. Finally, they received either a vaccination or a placebo shot. The Pfizer vaccine was authorized for children aged 12 to 15 on May 10. Adam Bright, whose younger son Tucker, 5 years old, is also taking part in the experiment, said it was well worth the opportunity. Russell, who was wearing a Spider-Man mask, expressed his desire for a summer break that may involve a trip to the water park or a longer journey, and then a return to school without masks and social isolation. Khalil was bashful and nervous, but his father, Jason Halperin, says he was excited because his parents and 12-year-old sister had all been vaccinated. Adam Bright is confident in the Pfizer vaccine's safety, especially after seeing how well vaccinations for the following age group are proceeding. Russell expressed his hope that if and when the vaccine is approved for emergency use in children his age, they will take advantage of the opportunity.
COVID-19. Vaccinate the world against COVID by the end of 2022. The UK Prime Minister announced over the weekend that he will urge G7 leaders to vaccinate the world against COVID by the end of next year. The real goal is to vaccinate enough people to develop herd immunity, which might be as high as 60% or 70%. Experts believe it is possible to achieve this by December 2020, but only if the G7 big nations act quickly. The UN-sponsored COVAX program should have provided the path to vaccination for low-income countries. It was created to be their lifeblood. By the end of the year, COVAX will have secured contracts with manufacturers to purchase 2 billion doses. However, it is stymied. Its main supplier is India's Serum Institute, which is currently producing vaccines in response to a horrific rise in domestic cases and deaths and would be unable to meet its obligations with COVAX or individual countries before the end of the year. Experts think it's pointless to wait until December to do so. It needs to happen now. People are currently dying. In Nepal and India, there has been a significant coronavirus outbreak, and there is concern about rising case numbers in Africa, where exact counts are not always possible. By the autumn, more vaccines should be available, and supplies should reach low-income countries. If further gifts arrive, those countries will be unable to use them all because they lack clinics, refrigeration facilities, and healthcare staff to administer the doses. Vaccines have an expiration date.
Thank you for watching. We help you stay up to date all the news hourly. Please subscribe our channel to follow up the latest one.